Thank you, Sripriya, and thank you everyone for joining us for another session. So today, again, we are dealing with a different topic. We were hearing a lot about the medical management till now. So today we'll be hearing about how to organize palliative care services. So this is taken by Mr. Binod Hariharan. Binod is associated with Pallium India since its beginning, and he's a trustee of Pallium India. Um, so he'll be taking you through the journey of Pallium India as an NGO and how it can help you all in organizing services in your own setting. And this session should be as interactive as possible because then only he'll be able to understand the context from where you are coming and how you can very well engage your community to build in a good practice in palliative care. So thank you, everyone. Thank you, Binod. Welcome to the session.
Thank you, Sridevi. Thank you for the introduction. And thank you for this opportunity. Good afternoon, everyone. I understand most of you here are medical doctors. Am I right, Sridevi?
Yes, all of them.
Yeah, very good. So I'm probably at a disadvantage here because I don't have a medical background. So one thing which I would like to mention here is that I am an engineer by training and ventured into this field as a volunteer, and then I'm involved with Pallium India for the past so many years. So I come from the other side of the society as a care receiver or as someone who has been with the sufferers. So I would like to, start off from that point. Can I share the screen? Just hold on. And I expect all of you, to step in and contribute so that we can make it more of a discussion wherever possible. Okay, can you see my screen?
Yes, we can.
Yes. Yeah. So today we're going to discuss a bit about organizing palliative care. Now, most of you might be wondering, why, what is the relevance here? So most of you being doctors, you're mostly coming from the point where, how to provide palliative care to a patient in front of you. So here it is we need to step back and think about how do we not just approach a patient in front, but also look at how we can add these kind of services to your existing practice. And I understand that all of you are coming from different settings or home settings, as I would put it. Like some of you might be working in a hospital where currently there is palliative care being offered. Some of you might be from a government hospital. Some of you might be working with a private institution. And for some, it might be even, at least some of you might be even working with a exclusive palliative care unit, or would like to start something on your own. So from different backgrounds, I guess. So we need to look at it from different viewpoints to have an overall picture, so that you can incorporate some of these things into your practice and make it more effective. So we look at these topics in general. So the essential components of palliative care program that's happening in India now, the challenges there, and how the community gets involved. What is the role of a volunteer and how that can make a difference. We'll also discuss a bit about collaborative working, how you can work with other entities to further enhance your productivity and even enhance the services, and a bit about advocacy and fundraising. So, so this is some, I think we have gone through this already in the previous sessions. What is palliative care? So I'm not going to spend much time on this. But we also understand that this requires an interdisciplinary approach to achieve this. Um, it requires a much bigger team to work with each one of you, right? Because it's across different settings, healthcare settings. Like it could start from a hospital, the patient may go to his home, and you need to continue providing that care there. There could be a situation where the person is again brought back to a hospice or an end of life care situation, or it could even be a long term care facility like an old age home or whatever. So, if we need to continue providing this kind of care, it calls for a much bigger team to be in place. So, let us start off discussing a very simple scenario. So I assume I am coming to you as a patient. I have common cold with runny nose and I have a mild headache. I am coming to you. I am approaching you as a doctor, medical doctor. How would you handle me or this particular case or situation, as you would prefer to call it? So you can step in and say, how you're going to approach this. What would you advise me, or what you can ask me questions, what you would like to know from me. Oh, sorry. Anyone? So my question is, doctor, see, I am having cold and I have runny nose, I have mild headache. Please help me. That's my statement.
There is a response in the chat.
Yes. Oh, sorry. Sorry. Thanks for. Yeah. Normally, just hold on. Let me just put this away. Okay. Fever, sore throat, travel history. Okay. So yes, I have a mild fever. Yeah, symptomatic treatment. Travel history. No, I haven't been traveling. Any associated symptoms? What, Dr. Arvind, what exactly would you like to know? I have these symptoms. Other than that, anything specific you would like to know? So, fever is there, headache, runny nose. Oh my God, I don't even understand this. Anosmia. Dr. Premlada, could you explain that? See, I am just a common man. I don't understand these terms. Cough or breathing difficulty, sinusitis. Cough or breathing difficulty, no, I don't have cough. At least now I don't have. No breathing difficulty either. Sinusitis. I don't know whether I have sinusitis, so mild headache I mentioned, so that is it. Loss of smell, taste. No, I don't have any such problems. Now you must be feeling, you must be thinking that I'm so stupid just to come to you with a headache and a runny nose, right? Anyone in the family having similar symptoms? No. No. Anyone in your home have similar symptoms? No. Should I even be consulting you? Should I even be coming to you? Reassure, travel, any other symptomatic symptoms, symptomatic treatment, born complications, possibility of COVID in view of, yes, possibility of COVID, yes. So probably if your question is, have you taken a COVID test? Yes, I have taken a COVID test and it's negative. So that is ruled out. Okay, is it affecting your daily activities? Dr. Anish, good question. Obviously, I am affected. I am not feeling comfortable. That is the reason why I approached you. So it's not COVID, it's not. Give symptomatic treatment for 2 days, stay at home and return if not better. Dr. Chitra says, give symptomatic treatment. Kavita Mahajan, doctor says, can be just normal viral fever, will resolve in a week. Okay. Yeah, that is reassuring. Anything else you would like to ask me? So I like the question, is it affecting my daily activities? And I said, yes. I'm worried, right? I have approached you because I'm worried. So I can be given that reassuring this thing, but I'm not happy. You said it could be normal viral fever, but I'm not comfortable yet. And a week is a pretty long time. Any other questions to me as a patient? Ear pain? No? Yeah, so I'll probably give you one more this thing. I have an interview to attend tomorrow. It's very important. I'm without a job for the past almost a year because of COVID. Yes, Dr. Chitra asked that question. Can I know what is bothering you? See, thank you, Chitra. That was a question I was looking for. So you don't know what is bothering me. Just a runny nose and headache and with a slight fever. It is something else, right? So now you know what is bothering me. It's the interview tomorrow. Because I've been without a job for the past 1 year. Now, how are you going to handle this situation? So would that reassurance that everything will be all right in 1 week be okay? So you can go back, take rest, a viral fever, it'll be okay in 1 week. Does the situation demand something else? You can, I would be more comfortable if someone, one of you unmute yourself and use the microphone. Chat is okay, but yeah, that would be even more comfortable. Yeah, Dr. Chitra.
Give reassurance. Now that you say he's worried that he can't attend the interview, we can tell it's just a cold and fever cough. You take a paracetamol and antihistamine, rest well, wear a mask, go for your interview tomorrow. You should be okay. We can give a reassurance.
Yeah. So paracetamol and antihistamine. What does that mean, Dr. Chitra?
Like cetirizine, which reduces the cold. But only thing, it can make him little drowsy.
Drowsy. Oh my God. So that's a problem for me. I can't attend an interview then, doctor, right?
Okay, then plain paracetamol and some steam inhalation should be good enough.
Okay. The runny nose would still be a problem, I guess.
If you ask me, I would go in for a traditional medicine where we can apply some pepper and milk in the head. It takes away all the water. You get very good relief with that.
Okay, great. Thank you, Chitra. So now you understand my concern and you have changed your, approach a bit. You have changed the medications now. So you're not advising, cetirizine, right? That's what you said.
Yeah.
Because it's going to make me drowsy. Any other suggestions? Thank you, Dr. Chitra. That was wonderful. Thank you.
Yeah, because of COVID, always wear mask.
Yes, of course. Thank you. Yes. Anything else? Anything else from anyone else? Okay, so yes, so Dr. Suji says non-sedative antihistamines like fexofenadine. So how does that help, Dr. Suji? Could you just explain that? Dr. Suji, you can just unmute and steam inhalation. Thank you. Yes, Dr. Kavita. Dr. Suji, would you like to, would it be possible for you to unmute and explain about this non-sedative antihistamine? Okay. So anyone else? What is special about this non-sedative antihistamine? Does anyone else recommend that? Oh, yes. Yes. Anyone else or Dr. Suji, would you like to? Okay. So, yeah. Yes, go ahead, Dr. Suji. Yes. Okay. So I guess, okay, certain nasal sprays are there for running nose. Okay, thank you. So I guess you all got the point. Now, you started out with this, most of you had the COVID possibility in mind. Then by the time you understood that it is just a normal, cold and there's nothing to be worried about, then the question changed. Dr. Chitra asked, "Can I know what is bothering you?" Now, when you asked that question, I was able to explain what I was feeling and what was the thing that was bothering me. And then the options changed, right? So of course, steam inhalation, paracetamol, and then the antihistamine was changed, and then now we have another non-sedative. I guess that is going to be more reassuring for me, right? So I don't end up in the interview room feeling, what do you call, uncomfortable, I would say, and that's going to affect my performance, and that could be a matter of maybe not life and death, but it could have serious effects on my future. And without going without a job for the last 1 year, it is very, very, very important for me, and you are trying to help me out of that situation. Now, thank you very much for considering my condition and helping me out, and that exactly is the approach what I would request each one of you. You could be a specialist in any field, but I'm sure that you will ask that question: what is it that is bothering me, and how you can help me solve my problem? It could be symptomatic, it could be non-symptomatic, whatever it is. Thank you. So we understand that the background, and you have already helped me with that. Thank you very much, and thank you for letting me in into your community as a non-medical professional and listening to me now. So who are the team members you would like to have? So we are going back to palliative care, where we explained about all this requirement of multi-specialists, multiple specialities coming together and all that. So this is what it looks like, right? So of course the doctors, pharmacists, therapists, counselors, and now I'm adding one more person to the list, a volunteer, family and other caregivers. So why is it highlighted, family and other caregivers? it's just because, whatever you try to offer, ultimately it mostly revolves around the family, which gives that day-to-day care for the patient. And if we don't consider that family as part of the team, it may not be effective. So am I missing someone here in this team? Do you want to add someone to this team which is going to provide palliative care? Anyone? Did I miss someone? Yes, absolutely. Thank you, Premlata. Thank you, Anish. The patient himself or herself, if we don't get that person in as part of our team, it's not going to be effective, right? So let us also consider that person who is going through that suffering as part of the team which is trying to solve the problem. And if we have that team member fully involved, I'm sure a lot of the problems, there'll be new and more effective solutions for most of the problems or symptoms. So basically, we are talking about anyone who can contribute to improving the quality of life of the patient and the family. So let us not leave anyone out. Just like you have accepted me as part of your group, maybe you'll be able to accept all these people, including the patient and the family. So we'll take another scenario and just discuss about this. So there is this scenario where you see or you hear your neighbor screaming all through the night. It's a lady, and you understand that that person is a cancer patient, and there are a few hospitals nearby, and there are a few doctors and nurses also who you know personally, but no palliative care facility. So how would you handle this situation? What would you do in such a situation? Assume that you don't have that palliative care, what you call, expertise or background. So this is a scenario. How would you go about? What would you do next? What would be your first step? Please step in. There is no right and wrong answer here. Feel free to contribute. Of course, sorry, yeah.
Yeah, this is Anil here. I would like to go and talk to the lady first and take the history regarding what is happening and what was actually, when she was diagnosed and what type of cancer it is and what is the problem, where the stage is. And based on that, I would like to, go ahead with the contacts and try to find out what type of care can be given to her.
So even if you are not a palliative care specialist, you would go there and meet that person. Is that what you're trying to say?
Yeah, definitely.
Okay.
Yes. So normal MBBS graduate himself can actually go and talk to the patient. That adds a psychological benefit to the patient. So definitely we can work out and get things done for them.
Okay, so thank you, Dr. Anil. We have a few other suggestions. Blossom Chapko says, to know the cause of screaming, visit first, says Dr. Premlata. Dr. Madhu says, visit their house, talk to the patient and family, and work on the best possible way to help. Dr. Aravind says, detailed history, how many days she is crying, is she having any pain, she having any bed sore, and discuss the things which with caregivers, why she is crying. So obviously, I think you got the core thing already. So the first and most important thing is to understand why the screaming, right? And to understand that the next step is to make that visit, whether you have the palliative care training or not, whether you are even a medical doctor or not. Still, that first visit, that first this thing to understand why that person is screaming. Now, is she having any pain? Now, that is a very relevant point, right? That pain need not necessarily be physical also. That crying need not be due to that. It could be something else. Or we need not assume that it is due to the cancer. Of course, she is a cancer patient, but the pain or the screaming may not necessarily be due to that. Maybe she has just fallen off a bed and she has broken her leg, and that could be the cause. So there are n number of possibilities, right? And the best way to approach is obviously to make that first visit and to understand why she is crying, and that will probably unravel a few other things. Now, this is not a fictitious situation. This actually happened way back in '92, and this person probably is the first first palliative care volunteer in the country. So that person was not even a graduate, let alone be a doctor. So, but he couldn't stand the screams, and he went out and actually went there, tried to find out why that person is screaming. And then he knew that, okay, this person was also pregnant, and she is a cancer patient. And he did not stop there. He went around, talked to doctors he knew, trying to find out if there was some. Yeah. Yeah. Trying to find out if there is someone who could help this person. And one person led him to another doctor. That doctor led him to another doctor. Ultimately, ultimately, he got across to a doctor who was trying to treat pain within a medical college facility in Calicut, within the Calicut Medical College, which is a government medical college. And they got together. They started discussing about how to, support such patients. And eventually, that evolved into the Pain and Palliative Care Society, which was probably the first NGO focused on this particular domain, that is palliative care. And normally in any healthcare setting, as we all know, it would be mostly doctors, nurses, maybe physiotherapists, other paramedical, this thing. And so you see a team of people who have some background in palliative, in healthcare, right? So what is the big difference here? A non-healthcare worker or a person who doesn't have any background in healthcare was also involved. And that, I believe, made a huge difference as far as palliative care was concerned in Kerala. And that changed the entire scenario for that matter. And that is what we probably, it is already well known across the world as the Kerala model of palliative care. And what is special about the Kerala model of palliative care? It's about these people, people like this gentleman who is not connected to the healthcare sector, also being involved in healthcare. So The bottom line is, it's about the approach. It's about not turning your head away. It's about trying to understand what the suffering is for the patient and trying to find out how or what best can be done in a particular scenario. So we move on. Thank you very much for the contribution. So whose business is it now? We are very clear. I hope everyone will agree with me. It's everyone's business. It's not just the doctors and the nurses. It's everyone's business. And that is one of the reasons why you are listening to me as a non-medical professional. So in India, we are still a long way off, but we still have palliative care in 3 different settings. There are these standalone centers. We call it palliative care centers. It could be within a hospital as part of the hospital's service offerings, or it could be community-based. When I say community-based, one specific community, people getting together and trying to support people in that particular community or in that area. So they may not even have, as I said, a doctor or a nurse specifically, or even a healthcare setting, as we call it. So now we have different audit tools also available. I'm not going into the details. You can find it online. There are links available. I'm sure Dr. Sridevi will be able to forward it to you. These are things that have come up very recently. Of course, there was one earlier. Now it is the new one that is there. And you also have these classifications, and some of these things are essential while some are optional, desirable, as they call it. So we are not going to go deeper into it. Of course, this presentation also will be shared, and Sridevi, I'm sure you will be able to share the links. Yeah, that's a reference for you. It's the audit tool that is available. Now, when you go deeper, you also have some of the statutory requirements that need to be met. So why I'm taking you through these things is, I'm sure after going through this training program, most of you might feel like doing something in this area. And I'm sure that is one of the reasons why you actually decided to spend so many hours on such a topic. So once you gain that knowledge, if you need to put it to use, it is good to have some of this background information, because this, what we're talking about, palliative care, is still something I would say nascent or new to India. It is not, if you consider Kerala, maybe you have a better penetration, better access to palliative care. But if you look at the rest of the country, it's hardly, it'll be only in single digit figures in percentage, like 4 or 5% at max. So a lot of the hospitals, a lot of the medical professionals, even, they don't know about what are the requirements, how you can provide this care and all that. So it's good for you to gain that knowledge and maybe share some of this as well. So there are quite a few legal and other statutory requirements which need to be met, and especially around this storing and dispensing of opioids. As you know, it's a regulated drug and it comes under the NDPS Act, and you need to have that special, it's not about license. Actually, you need, I think it's a wrong word, but you need to have that RMI status, which is recognized medical institution, for which one of these training programs are also required. And of course, if it is an IP facility, what you're talking about, you need to have those kind of licenses, especially if it is a standalone unit. It may not be applicable in a hospital setting, but if it is not, then that is also important. And again, most of these things are applicable if you're setting up something new on your own. And if you are looking at raising funds to provide this kind of care, make sure that you have a separate bank account for that purpose. Especially if you're collecting money from public, you need to be very, very careful about maintaining those accounts, because there could be questions asked by many from different parts, so including government agencies. So make sure that you maintain separate accounts, the proper books of accounts are kept, and there are certain reports that need to be sent to the different government authorities. Make sure that it is done on time. So maybe you'll require someone to help you with some of these things. And I'm sure you'll be able to find a lot of such people who are willing to support you with most of these things. So, and of course, make sure that people who are directly involved in palliative care, in supporting you, maybe even a nurse or people like that, they also have the necessary qualifications, the educational qualifications, which are prescribed as per the norms. So, what are the challenges for the PC to come up in India? Still a whole lot of these things you're already aware of, but most of these things cannot be changed overnight. These are big challenges. But having said that, there are major changes that are happening, especially in terms of policy and even funding to some extent. There is more. I mean, it is available from different agencies now, including the government in most states. And of course, the one big gap is trained professionals, or at least palliative care as a stream being recognized. And so that is still a long way off. As you all know, there are hardly 2 or 3 colleges in India which offer an MD in palliative medicine. Dr. Sridevi, is it 2 or 3?
I think it's 3.
3, yeah. So a long way to go. But then there are these certificate programs and fellowship programs which are available in other locations. So, and most of the hospitals are also not too keen to provide this kind of care, maybe because it's not lucrative enough. It's not money making as much as for an advanced surgery or some of these things. So if you come back to healthcare delivery generally in India, or for that matter, any part of the world, you can see at the macro level, there is the government and healthcare institutions, like it could be medical colleges, hospitals, at the macro level, right? And at the micro level, as we discussed earlier, it is always the family. Okay, so whatever is after the consultation with the doctor in a hospital, the patient normally goes back home. I'm not talking about just the palliative care patients, any patient in general. So like earlier, you suggested steam inhalation and a paracetamol and antihistamine for me. Once I get back home, most of these things I may require support of my family members. And if I am supposed to take rest, someone has to probably also get food for me. Like if I'm asked to take rest, I'm supposed to take bed rest. So where would the food come from? Of course, I can order it online now, but yeah, but still you need support of the family, and they are the primary caregivers. Now, so at the micro level, it's always the family we cannot ignore. And if I have a problem, the first person who is going to attend to my problem is probably my parents or my siblings or my children. But we also have this level, we call it the meso level, which is in between that macro and the micro level. And this is where things get very interesting. And this is you and me included, which is the community at large. So a lot of these challenges, like I mentioned earlier, about the big team which is required, the money that is required, the setting that is required, a whole lot of other things. Often we tend to think that it is such a Herculean task and we'll not be able to overcome those challenges. But then let us also not forget that most of these problems can be sorted out, or there is a solution there. We call it the social capital. And that is it's a huge treasure chest, if I may put it that way, which is locked and kept. And it's up to you to find that key. Once you have the key, you're able to open that treasure chest. You have most of the solutions out of that box, coming out of that box. And there's a huge untapped potential lying in the society around you. Let us not forget that. So this is a definition of volunteer, and I'm not going to take much time. So okay, it's 3:40. It's a person who is taking on a responsibility without being ordered or assigned to do so, and without a compensation. It's a monetary compensation, I would say. Now, this is the story of a gentleman who retired from the army, and in 2002, his wife was diagnosed with cancer stage 3, and eventually, after 2 years, she passed away in November 2004. Now, I want you to imagine being in his situation. Like they say, put yourself in his shoes and think of what you would be going through. What would be the thoughts going through your mind? What would be your feelings at that particular in that particular situation? So I'll repeat it. So you have retired from the army after a very long period serving the nation, and then within the next 10 years, your spouse, could be, and in 10 years, your spouse is diagnosed with stage 3 cancer, and that person passes away in another 2 years. So, comments? So the question is, what would be your thoughts? What would be your feelings? What would be the emotions that you would be, that would be going on in your mind? Again, no right and wrong answer here. It's just what you would be going through. You can use the chat box or unmute yourself and share your thoughts. Depressed. Dr. Kavita says depressed. Of course, yes. Why only I have to suffer? Who will cook for me? How can I stay alone? God is very cruel. So the God thing is a spiritual this thing which is coming up. Why me kind of thing. Usually disbelief. Thank you, Dr. Chitra. And Dr. Vaidyanathan says usually disbelief initially. Why me? Yeah. Why is God so cruel to me? Anything else? So depressed. You have this feeling that God is not being fair, is very cruel. Anything else?
Okay. Loneliness.
Absolutely, yes. Dr. Achama says loneliness. Thank you very much. Very difficult, but involving in some interest field may help. So that is the solution part. I'm just, Premalata, I was just, looking at what are the emotions, the feelings that you go through. Now, I'll add something more to this. From, problems started a bit earlier. It was not in 2002, at least 2 years back, when she had pain and this gentleman took her to almost all the major hospitals, all the known doctors, including oncologists. And it ultimately, what happened was in 2002, after 2 years, by the time it was diagnosed, it was stage 3. So it was not that, she was not taken to a doctor. There was no consultation happening, and including oncologists. And what we understand is she was not asked to undergo a pap smear test, which should have been prescribed. So that, if you consider that also in that situation, so it's 2 years, you're taking your wife from one hospital to another, or your husband from one hospital to another, meeting all the oncologists. And by the time it is diagnosed, it is already in a difficult situation. So Ashmika says, initially depressed, but then what next? Life has to go on. Thank you. Sujit says, I now know what a patient and a relative with cancer goes through. Can I use my experience for helping others? That's a wonderful thought, Dr. Sujit. Yeah, some people think of it that way, but not for me. Someone like me wouldn't think of it that way at that point. Take time to adapt and get back to life after regaining mental strength. Thank you, Blossom. After initial depression and working on what was wrong, did they miss early diagnosis? Could the eventuality be modified? Next step, how and what I can do to prevent such in my known people? Okay, thank you, Madhu. So, yeah, so there is this depression, and then trying to understand what actually went wrong. And he did that. He went and studied all the reference books available. And he consulted many others, doctors, and that was when they also told him, this is something which could have been identified earlier and all that. So, yeah, you're right. So once you realize that it could have been identified earlier, what would you be feeling? I mean, what would be the emotions you would be going through then? Moving forward to prevent such situations? Yes. Anything else? That is, Dr. Madhu says guilt. Why so? Could you explain that guilt a bit, Madhu? Why should you feel guilty?
Yeah, the guilt is probably for the reason I could have done something. I could have prevented to an extent. I could have probably changed the course. I was not there at the time of the need, or it was not in my hand, which I could have done at that point of time. That guilt, because I am telling this because I had gone through similar in my own personal experience. So that guilt keeps haunting you. Could I have done anything? Could I have done anything? So that's
Thank you, Madhu, for sharing such a personal experience. Yes, you tend to go through that guilt. Could I have done anything more for her? Could I have taken her to a better hospital, a better doctor? And as Sujit says, you also consider that element of negligence from the side of the medical team. Yeah, so once you get there, Sujit, what would be your feeling there? If you feel that there is an element of negligence, and because of which it was diagnosed late. So Sujit, suppose you were in that situation and you feel there is this element of negligence, what would be your reaction?
I would try to see first of all whether this negligence was really there or not, or is it my feelings. If it is there, then I would be most concerned about anybody else who's had the similar situations, to warn them that they need to do what they need to do, or what has happened to me.
Okay, thank you. So if I were in a situation, I would be feeling very angry at the whole system. I don't know about you, but I'll feel angry. I'll feel like, going and meeting these doctors who didn't give a proper diagnosis at the proper time. I would probably go and even to the extent of violence, probably. Sometimes I may even take up decide to fight a legal battle. So it's anger. Yeah, thank you. Anger is one of the first reactions. Of course, depression is there. But and you see this often, right? It's happening even now. You hear stories like this from across the country. Doctors being manhandled, hospitals being burned down, or so those kind of violent reactions, it comes out of that anger. So it need not necessarily be due to the fault of the doctors or the hospital, but still, as a patient, as a caregiver, these are the emotions that you go through. Now, Dr. Anil says create awareness among the population. Absolutely. So what kind of awareness? Yeah, we'll discuss a bit about that also. You don't want to leave the place thinking that your partner is still there. Yeah, it's another emotional struggle that you go through. So to add to this complexity, can you imagine what this doctor who actually made the diagnosis, what his comments were to this gentleman once the diagnosis was made? Can you guess what his reaction was, or what he told Mr. Nair? Anyone? So after 2 years, going from doctor to doctor, yeah, Vaidyanathan says, if you had got her earlier, probably we could have saved her. Yes, that is exactly what he told him. That, why didn't you bring her here earlier? If you had, brought her here earlier, if we could have diagnosed this, things could have been better. We could have had, we could have saved her. And that is not just, that is guilt inflicted from outside, right? You add to the, already you are feeling guilty. Already you are having all these thoughts, the anger, the frustration, everything. And on top of that, you from your side, I'm not saying from your side, so I'm saying from the doctor's side, you have this added sense of what you call guilt thrust upon. So it's not a very comfortable situation. Now we'll look at the options, like many of you have mentioned. You would think of how you can move forward to prevent such situations. Can I use my experience for helping others? Now, very few people actually go through that thinking process, because most often you would end up fighting against the hospital or the doctor, spending your time, like I mentioned before, it could end up in violence and all these kind of things. But for some, it's the other way around. You start thinking, and that is his story. Mr. Nair started thinking how I can help people in such a situation, how I can avoid someone else going through such a situation. And that is when he initially got in touch with the IMA, local IMA. Sorry, Arvind, you want to say something? You have raised your hand. So. Okay, maybe.
MC.
Yeah. Okay, maybe by mistake. So he decided, he would like to spend the rest of his time, rest of his days or months or years, whatever, to make sure that others get some benefit out of his work, or help them out with such situations, help people out in such situations. And eventually he he came to us in Palliative India, worked with us, and in fact, of course, eventually there was a bike accident which incapacitated him. In fact, he had a knee surgery, and then he could not join the team for the regular home care visits and all that. That was the sad part of it. But then why I explained this story was, this is how most volunteers are born, through an experience of their own, or seeing someone in their family or their neighborhood going through such situations, feeling that the pain or the suffering, I think it was Madhu who mentioned he had gone through something similar, and that is exactly where we feel that I should also contribute to this. I should also be part of the solution to be offering to that could be offered to the people who are suffering, and that is where most of this begins. Now, if you look at a volunteer, if I ask you, what are the ways in which a volunteer, when I say volunteer, a person who is committed to this cause, a person that, his or her being involved in this healthcare can actually make a huge difference. So most often you find that, you restrict the role of a volunteer to maybe some social support activity, maybe fundraising, or something like, even running a few errands, getting some maybe tea and coffee for the medical team. Now that's a huge mistake. The kind of roles that a volunteer can play, it is unimaginable. It can go from one end of the spectrum to the other, and it can, as listed here, you can think about almost all the possible areas where they can contribute, provided they have the necessary background and the skills to take care of that. Now, it's also important that the heart might be there, but if you want the volunteer to be really effective, you should also ensure that he or she undergoes a training program, because unless you have that additional knowledge and let me put it this way. We say there are three things that need to come together to provide any kind of a solution or a service. Can anyone say what are the three things that need to come together? So there are three things which need to come together to provide an effective solution for any kind of problem, and that's the same case in palliative care also, and more so in palliative care, I would say. So it's AS, yeah, someone. Clarity, compassion. Okay. Thanks, Dr. Chitra. Anything else? So it is ASK, the attitude, the skills, and the knowledge. The attitude is, like we say, the heart to do it. You always say he has got a good heart. The compassion, what Dr. Chitra was mentioning about, that is heart. But with a good heart also, actually, if you don't have the head, the proper knowledge, or I call it the heart and the head, you could be doing actually, you probably would end up doing harm to the patient than actually helping. Like a simple thing like hand hygiene, which is not practiced properly, can actually have disastrous results, right? Now, there are things that now, having gone through that, what do you call, the communication sessions, I'm sure most of you might have attended those sessions. You know how a simple word or a simple sentence that you say, how it affects the patient or the family. Now, that is knowledge that you should have before actually trying to help a person in such kind of a situation. Now that knowledge is also there, and then you have the skills, or I'll put it as hands. Now, it's not actually just hands. It would be like, the time, the physical ability to do the work that is required out of you or expected out of you. So these three things have to come together. So training program for a volunteer is absolutely essential, and the time, and you should also be able to identify where that person can actually contribute. So sometimes it also requires you to screen those volunteers, so that you know that the person is serious enough. And sometimes, okay, a formal application and interview may not be practical initially, at least, but we can always find out whether this person has the qualifications and the level of commitment to actually deliver this. So the challenge here is, now, as we discussed earlier, we are not talking about a salary or a monetary compensation for most of these people. So it's important to understand what makes them do it. Like Mr. Nair, there might be a story behind it. And if you understand them better, if you understand their story, where they're coming from, that is when we'll be able to identify what we can offer and how we can, keep them contributing to this cause, and keep them engaged, as we call it, and keep them happy also, because happiness is something which we are all in pursuit of, right? So, having said that, again, volunteers, some people may say that it might be easier to get volunteers in Kerala. It is not so in the rest of the country and all those things. But I tend to disagree. People have good hearts generally. And if you see someone falling by the roadside, you tend to help him out. If there is an accident site, I'm sure at least a few people would go there and pick that person up, try to give him water. So that compassion and the will to help or support is already there. So, but of course, the culture and the individual preferences and all those things may vary, but generally that volunteers are available. It's only that if they realize that there is something where they can contribute and help support the cause. And someone mentioned about the awareness. That awareness is also very important. That is what makes the difference. Sorry. Now, we come to collaboration. Now, what is it about collaboration? So, why collaborate? Now, as we discussed earlier, there's a whole lot of challenges in a country like India. So, if you really need to achieve some of these things, you need to be working or need to be able to work with a lot of other entities and individuals. So, when you're working with others, when you're working with other entities, you need to ensure it's challenging. So why do we need to do that? Because through collaboration we can achieve better productivity and innovation. And today the scenario is changing. It's not just the NGOs which used to be there in the picture. Now we have public health systems. Oh, I see. Okay. You're not able to see the slides, I guess. Which slide are you on? Which is the one you're seeing now?
Sir, this is the story of K.M. Nair. I believe you moved on to the next slide, but
No, which slide are you seeing now?
story of K.M. Nair.
Oh, okay. Sorry. I don't know what is happening. Let me just check. I'll just stop sharing and then share it once again. Thank you for letting me know. Sorry. Is visible now?
Yes, sir.
Yeah, okay. Sorry about that. So yeah, anyway, I'll be sharing the slides, so that shouldn't be a problem. So we are talking about collaboration, and today we have, there are even private hospitals which are providing palliative care services for a fee. You have the full public healthcare system, which is also supporting. So if you are able to work together, it can increase the quality and coverage of for the patients. Like I mentioned earlier, in India, if you look at access to palliative care, it is still less than 5%. So that is not something which we can be proud of, right? So if we need to have better coverage, better quality, this is probably the answer to that. So if you look at Palliative India, we offer our services directly to patients in Trivandrum. But then even in Trivandrum, if you look at the number of patients that we are able to serve, you can imagine, like if you have an entity, an exclusive service as a service provider, maybe you would be able to handle maybe a few hundred or even a couple of thousand patients at a time. But then if you look at the need out there, the overall need would run into tens of thousands or even a few hundred thousands sometimes. So how do you achieve that? It's not easy doing it alone. So that is where what we do is we work with other similar entities. It could be different entities, like it could be a hospital. Sometimes you work with a hospital, you provide care to, like for example, in Trivandrum, we provide these services to patients in the medical college hospital. So there is an understanding with them that every day from around 1 o'clock to 4 o'clock, we have our team of doctors, nurses, along with opioids, being there, available there in the medical college hospital, providing palliative care consultation, and if need be, we take care of them at their homes also eventually. Now, it could be other scenarios like a community-based organization which is interested in supporting patients in a particular locality. They may not have the doctors and the doctors or nurses with them, but then we provide that support, and they organize this the OP consultations and all those things, or even for home visits. They identify the patients, take us to them, and so it could be different kind of entities. We work with them, understand what they require and what we are able to provide. So which means the reach could be much more. If you are able to touch 1,000 lives directly, indirectly we might be able to touch 100,000 lives. So that is the whole idea. And just touch through the story because we don't have enough time. So see, there was a palliative care patient. She underwent a surgery and then in her spine, and then she was paralyzed. She was wheelchair bound, and that is when she came to Palliative, or rather, we got to know her, and then there was some initial support which was required. Like for example, physiotherapy and other things. And then how it is changing into a wheelchair mode. So you need to adapt to the new normal. So those kind of things. And then she got tuned to the new, probably to some extent at least. And then there came up the big question, what next? How is she going to survive? She had two elderly parents at home, and she needed to take care of them as well. So how do we ensure that she earns a living? Now someone comes with a brilliant idea that we'll teach her how to make jewelry, and she starts. Of course, she had some artistic inclination. So a few of the volunteers got together, trained her on making a small jewelry sitting at home. That led to the next big challenge. Making jewelry is one thing, and converting it into money is another challenge, right? So you need to be able to sell this, whatever is made. So someone else comes with an idea that, okay, you could sell it online. Selling it online is easy, but for someone who doesn't have even knowledge of operating a computer, that is not going to be easy, right? So a team got together, decided, okay, we'll teach her how to use a computer. So she started learning how to use a computer, and the basic stuff. That once she went through that, now the challenge was to ensure that she had a computer at home. So we put out an advertisement, or rather a request in our social media and other places, and a gentleman came forward offering a used computer for her to use, and it was sponsored. Okay, so we have a computer. The local cable operator came forward and said, okay, I'll give her an internet connection. Not just that, even the local people actually supported. In fact, she didn't have a proper access to her house. And like any of our houses, her house was also not wheelchair friendly. Like you might have seen, you might have a wheelchair, but you may not be able to use it in our homes, right? So that needed to be changed. Again, the local masons and other people contributed. They helped, supported in that area. The local panchayat got involved. They made sure that the road the access was widened and it was motorable. So why am I telling this story? Today, with all this, now she makes jewelry, sells it online, she makes a living out of it, and not just for her, she also supports her family. And she's the only earning member of her family. Now, this is about, ensuring that a person is reintegrated back into society, that person's dignity is restored, right? So you could probably offer her, say, 10,000 rupees every month, but that doesn't solve the problem, does it? The pleasure you get out of earning something for yourself, taking care of yourself, your family, that is something else. And for that, if Palliative India were to try to do it on its own, it wouldn't be possible. So here is a story where, the panchayat had a role to play, the neighborhood had a role to play, an NGO had a role to play. So when everything comes together to support such patients and families, we will be able to ensure that these people also do not end up suffering and losing their dignity. So 4:15, I think we'll run through these few slides that are left. So where does this collaboration start? I would say it starts with me here. It starts with the inquiry about how it happens, what, why, how, those questions which need to be answered. And once you're clear about those answers, then it's about innovating, because it's going to be challenging. It's not like you decide on something and everything else is set up for you so that you can just start providing palliative care. So you need to be innovative. You need to find innovative solutions to the challenges that you are going to face when you try to provide that kind of a service. And it could be different for each one of us. And once you are able to innovate and provide, the service to the expectation, or at least to some reasonable level of quality, and meeting the expectations of the society, it inspires a lot of people. And that is when you actually start seeing many such KNIers or volunteers coming and joining in, and it creates a huge impact. And that impact can actually have a ripple effect. It affects it actually reaches out to the community, the society at large. It can have that ripple effect and go on and on. So what is the key to collaborative working? Now, if we need different people to work together, like for example, a medical college, and you need the local panchayat to work with us. So what does it mean? I mean, each one of us or each one of these entities have their own specific goals, their own specific, very selfish interests, if I may use that word. But then when you're working together, we cannot ignore the fact that we are all human beings. We have our weaknesses. Just that we have one common goal, or say that, okay, we are going to help this patient. Everyone is not going to jump in and start off that way. So, but still, where does it begin? How do you understand what each of these other partners want, and make sure that we work together? It's a very simple answer, and that is the only way out. And that is about listening to what each of these partners, each of these potential partners have to say, what they want out of this. And that is where collaborative working will really happen. So advocacy and fundraising, because we are running short of time, maybe I'll just take you through this. Nothing but, you have an advocate in the court fighting your case because he is better equipped to take care of your requirements in a court of law. Just like that, most often you find that the patients and the families are in a situation where they are not able to fight for themselves, or make sure that what they want is achieved, or you get it from the society. So it's up to all of us to be able to draw the community's attention to this need and be an advocate for them. So that is the whole idea of advocacy, being an advocate for this set of patients and their families who are really suffering. Now, where do we focus on there? Like, we go back to what someone said early on the chat. Awareness. It's mostly about creating that kind of awareness, and you can add to this list. How do we create the awareness? Of course, media plays a big role. The government machinery, they can make a huge difference. So we need to be working with all these agencies, like the government bodies, be able to convince the government officials, get clubs and associations involved, and even social media. Now, let us not ignore that. When I say other media, press and other media, social media is something which can make a huge impact, right? And of course, schools and colleges. Why? Because that's the next generation. Once we put the seeds there, it will grow. And this awareness, if we are able to ensure that it reaches the schools and colleges, at least our next generation may be in a position to get the kind of the palliative care that we are talking about now. So it changes attitudes and behaviors. Policy changes can be ensured. There could be huge reforms happening. And whatever you're trying to do, it creates a broader impact. So each one of us, we need to learn a bit of advocacy, or at least acquire some of the skills required for advocacy. And we need to be their advocates. And interestingly, it also helps fundraising, because Once the awareness is created, it automatically leads to raising more funds. If there is no awareness, there is no funding. One example which I would quote is that ice bucket challenge. You know what happened there, in the social media, where all the celebrities started pouring having this dumping ice buckets over their head. And that is when people started realizing that there is a condition called ALS, and nobody even knew about ALS prior to that. And then what happened? It was millions of dollars which was raised for that particular cause. So fundraising, whenever you say that there is not enough money out there, money is there. It's only that, it is not available for that particular cause. Now, how does that happen? It's only when the people who are, the people who are aware of this, the need, they start, decide to come out and help people. Now it's about people giving to people. Now nobody wants to give money to Palliative India or any of such organization. If I am giving money or I am supporting someone, I would like to support the patient. Now, where does the organization come? Only if that organization is able to help a larger number of people. And that is the only reason why people should give money to you or me. Because if they are clear that giving money to me can ensure that 100 other people get palliative care or support, or whichever way the support is ensured, that is when they start giving. And it's not about money alone. I can go on and on with so many stories where you probably need medicines, and for buying the medicines you may need the money. Now, if you are able to get hold of a distributor or even a manufacturer of the medicine who is willing to give it free to your patients, why do you need the money? You don't actually need the money, right? So money is just a means to an end. So if we focus on what we actually want, maybe things can be easier. Like I said, it's about unlocking that treasure chest, that social capital. It might be there. And it's all about emotions. Like you see this often happening in social media, right? Wherever there is a fundraising happening, it's about appealing to emotions of the people. Because again, remember, we are dealing with people's minds. And if someone has gone through something similar or experienced that, or at least has a clarity about what these people are going through, that is when they start contributing. So it's about, again, inspiring them to give, like we talked about earlier. When they see good things happening, that is when they are inspired to contribute more. So again, being a good listener helps, because the donor will decide what he wants to give, how he wants to contribute, and you can see them as partners in this particular project, and you can share your problems as well as the success, which means you work as a team. The donor is not actually someone outside. It is, again, he can be considered part of the team that we talked about earlier, the palliative care team. So once we recognize that person also as part of the team, his involvement will be more. You don't need to actually ask for money. That money will actually come to you. There are other possibilities, but of course you need additional skills for that, like grant writing skills, campaign management skills. If you have those, you could look at devising other ways of raising funds, larger events, larger campaigns, just like the ice bucket challenge is something which is possible, but then you need to have those skills. So with that, I end. I think we have hardly 5 minutes more. So open to questions. Yeah, anyone?
Binod, maybe I can ask a question on behalf of them. So many
yeah.
of these doctors are working as a standalone, like they work alone in their department, not specifically in palliative care. So anything for them that they should do all these advocacies, and it's not really easy for a single person to go and do all this. Many of them are working as a standalone practitioners. So anything for them.
Would anyone want to answer that question from among our participants? It would be interesting to hear, listen to your thoughts. Thanks, Chitra. So you have something to contribute here. So this is a very valid question. So Dr. Sridevi is asking, as a specialist, as a medical specialist, you may not be able to go out and do serious advocacy work, but what can you do individually?
So we are from the Anil and I are from community medicine department. Working in a rural medical college. So this is something which we thought we could take up, work in the community. So your session has given a lot of input here. So we are not standalone. If our management is supportive, we can do something, at least make a beginning.
Okay, thank you. Good to know that, Dr. Chitra. So to go, if you go back to Dr. Sridevi, this thing, my take on that would be, advocacy is not about reaching out to hundreds of people. It always starts with one single person. So even if you're able to talk to one doctor or one additional person out there, and even a conversation about palliative care, how it can create a difference or make a difference for a patient, for your patient, even that storytelling is advocacy. And remember, it always starts with one. Even if you want to reach to 100 or 1,000 or 1 lakh, it starts with that one. And 1 plus 1 plus 1, ultimately will be equal to 100. So that is one. Second is, as specialists in this field, patients come to you with different ideas, concepts. People come from different backgrounds. Now, you could always start off with something like you did with me. What is bothering you? Any specialist can do that. And while having that conversation, maybe that patient will start talking about his concerns. And it may be as simple as that interview, or it could be something like my daughter's wedding. That would be a big concern. And I'm having cancer. I'm okay with it. I know I'm not going to live that long, but I want to be there for that wedding. It's just about being there for the wedding for the next, which is going to happen within the next 1 or 2 months. Or it could be like, I just want to ensure that my kids' education, that is not suffering. Now, that is not affected. Now, if you're able to understand that and provide a solution for that, maybe not directly. The question would be, what can I do for that? That is where the collaboration angle comes in. You could always get in touch with one NGO which is out there to take care of kids' education, or another NGO which is supporting what you call a marriage. I don't know. So it's about connecting them probably. So that is number 2. Another thing is referring it. As specialists, we often find that referring someone to palliative care is a big thing. Yeah. Okay. So even by referring someone who, if you identify someone as a potential a patient or a family which requires palliative care, by referring them to the right person or the right palliative care service provider, that itself sorry, can make a big difference. So as individuals practicing in this field, as specialists, there is still a lot you can do. It need not necessarily be doing advocacy for hundreds of thousands. It could be for one individual at a time. Did I answer your question, Sridevi?
Yes, yes. I just wanted to represent them because many of them are working in a hospital.
I understand. So generalist and specialist palliative care services database and networking will enable better reach for the individual service providers and also the needy patients and their caregivers. Media and volunteers can be inspired by conducting awareness programs as and when feasible and essential. Absolutely. Thank you very much. Yes, awareness is one big thing. It can make a huge difference, unless people are aware of the possibilities, the opportunities. And it's not just about the common man. It's for specialists also. And I wouldn't be surprised if, you find doctors asking, what is palliative care? So that is also a reality now.
Any other questions from others? I think it was Dr. Sankamitra during her session mentioned about creating awareness in the institutions where you work, starting from the receptionist or the security up till the medical superintendent, so that people are aware about, and whenever you get an event like a World Palliative Care Day, just make sure that you stick some posters somewhere, give a talk to your friends so that they were aware of what you are trying to do with the institution. So support from the institution is very important for many people who are working in private hospitals or even in government hospitals. So if there are no other questions, then maybe we can wind up today's session. Thank you, Binod, for being with us for the session, and thank you everyone for being interactive through the chats. Sri Priya?
Thank you, Sridevi ma'am, and Binod sir, special thanks to you for sparing time for this cohort and briefing us on how to organize palliative care services. We believe that this has been an eye-opener for everyone, as Dr. Chitra rightly said. So with that note, this is Sri Priya along with Dr. Sridevi Warrior signing off from the Tips Recorders. See you in the next session. Till then, everyone, take care. See you. Bye-bye.
Thank you, everyone, for contributing and being, making the session an interactive one. I really enjoyed the session. Thank you very much. And I hope you'll all ask that critical question, what is bothering you and how can I help you? I think those two questions will make a huge difference.